Hi, my name is Pam, and together with my groupmates Chelsea, Sabina, Pam, and Ridden, students of Western Sydney University, we're going to talk about the mental health assessment or mental state examination that Nurse Anne conducted with Jake. From the transcript, we can see that Anne, the nurse, introduces herself and immediately establishes the purpose. I'm just here to have a little chat with you just to see what has happened and what's going on with your life and see if we can help you in any way. This reflects what LOHED 2022 describes as the descriptive interview, which involves collecting information about an individual from which a picture of this person may be developed. This suggests that the nurse is positioning herself as interested in the person rather than simply addressing his problems. The nurse also introduced herself by saying, "My name is Anne, and I'm one of the nurses here in the emergency." This follows Barker's 2014 guidance about the interviewer needing to introduce herself by her name and professional background. However, her confidentiality statement is concerning. She says, "You can rely on me for confidentiality," while also stating that she will share it with the team. It can also be observed in the video that there are environmental considerations, such as the appropriate place, setting, and absence of potential interruptions, thus effectively reducing power differentials in communication. Now, critiquing the interviewer. The nurse demonstrates several therapeutic relationship skills that align with current best practice. She shows empathy and genuine concern, particularly when Jake becomes emotional, offering tissues and reassurance. This reflects what recent research identifies as crucial therapeutic relationship characteristics: mutual respect, empathy, and a non judgmental attitude, which creates a safe space for clients to discuss their concerns. Her use of open ended questions like, "Do you want to give me a sort of an introduction of what's happened to you?" follows Barker's principle of using questions that provide the person with an opportunity to talk at length. However, her approach could be more recovery oriented. As noted by Barker, a recovery focus seeks personal knowledge and preferences that have been hard won through lived experience and recognizes that a person's autonomy as well as support are critical.
Thank you, Philomela. Hello, everyone. My name is Param, and I will be continuing for my colleague's overview. A principal aspect of this assessment is how the nurse elicits Jake's story of what brought him in today. The opening phase, orientation, introduction, and a confidentiality statement is not just procedural, it establishes psychological safety. Clients disclose sensitive information only when they trust their dignity will be protected. Research highlights that early orientation and confidentiality build trust, reduce anxiety, and promote openness, which is vital in care planning, as stated by Hunt in his research done in 2021. In this interview, a nurse greets Jake warmly, introduces herself, and clarifies her role in the emergency department. She reassures him about confidentiality and explains her aim is to understand his experience and how the team can help. This built rapport, though her confidentiality statement could have been clearer about limits to privacy, such as when safety is at risk. Literature showed that effective initial assessment lays the foundation for trust and recovery focused dialogue. And as cited by the research done by Pocket in 2024, Jake presents withdrawn and subdued low eye contact, quiet voice, and depressed posture. The nurse compassionately acknowledges these observations, fostering understanding without the stigma. And as Jake reveals that recent traumatic events led to a suicide attempt, the nurse listens attentively, using open ended questions to explore trauma, isolation, and low mood. Her calm approach allows Jake to open up, which demonstrates an MBA standard 2.2, engaging in therapeutic relationships grounded in respect and empathy. Ethically, this respect beneficence and non maleficence as she acknowledges his suffering while working to ensure safety. The nurse prioritizes Jake's safety, recommending hospitalization after his suicide attempt. This aligns with the Code of Conduct Principle number 2 and NSQH's comprehensive care standard. However, she did not co create a structured safety planning intervention, failing to explore means safety at home or access to medications, limiting collaboration. Recovery oriented strength based care emphasizes autonomy, hope, and recognizing a client's resources. And this is stated in the research done by Malilo in 2025. The nurse notes Jake's resilience, survival, and family support, yet her approach remains problem focused. A stronger recovery based approach could have been invited to Jake to articulate his goals, validate his military identity, and identify protective factors such as social connections or meeting beyond trauma. The NMBA Standard 2.7 stresses shared decision making and recognition of strengths, which could have been expanded in this interview. In summary, the opening phase demonstrates empathy, safety focus, and initial rapport, but could have been strengthened through clearer confidentiality boundaries, collaborative safety planning, and deeper exploration of Jake's strengths to foster recovery oriented care. Thank you for listening to me, and my colleague will now continue from here on. Thank you.
Hello, I'm Chelsea, and right now I'm going to do Jake's mental state examinations. For the appearance, Jake is an Asian-looking male consumer with an average appearance, weight, and height, stated age 22 years old, and brought by mother to emergency department. During the interview, he was unshaven with unkempt hair. However, he was dressed clean and appropriately. For his behavior, Jake was cooperative during the interview, yet guarded. His body posture is limp, had sad facial expression with lack of eye contacts and minimal body gesture when he did the touching nose, cheek, and fake hand during the interview. He was being avoided in the sessions and at times showed sign of distress when explaining past experience in the army. This could be a sign suggesting a state of depressed where we showed reduction of his energy in expressing his emotions. For his effect, Jake was in constricted range and have a blunted intensity, means reduced emotional expressiveness. He showed reactive with presence of congruence with content. He demonstrated sadness and guilt with matched discussion of the experience. He said he had sleep disturbance, frequent nightmares, and poor sleep. His energy and motivations was low, with anhedonia implied, with lack of interest in activities and or future plans. For his mood, Jake stated he has been feeling pretty low for months and that he wanted not to feel anything anymore. He admitted that this feeling has gotten worse over the last few days, while he appears to feel some sense of relief that he is still alive. However, he lacks any positive outlook on the future. He admitted his mood is worsened by his past trauma during the army and ongoing career break. He also acknowledged some regret and guilt related to his mother discovering him post-attempt suicide. His overall mood is low, profound due to sadness and despair. For his speech and language, Jake's speech and tone was flat at times with a low to moderate volume voice. He spoke at a normal to slightly slow speed with occasional pauses and hesitations. He did not elaborate on his answer much unless specifically asked by the nurse. He also spoke fluently in English, using simple vocabulary, direct sentence, clearly and coherently. However, he did not present any signs of slurring or dysarthria, although he had consumed alcohol recently. This can be an indication that he had slow thought process due to lack of energy and on state of depression. For his thought of form, Jake's thought of form is logical and linear. His responses were relevant to the questions from the nurse, although there were occasional pauses when reflecting on the trauma that he experienced, for example, the war in the Middle East. He was able to follow and answer complex questions, for example, perform serial sevens, which he did correctly, and respond to the proverb, too many cooks spoil the broth. However, he failed to correctly answer date and place questions. There is no evidence of flight of ideas, loosening of associations, and any other thoughts of form disturbance. This confirming that Jake's concentrations and cognitive function is intact. However, he has disorientation in time and placement. For the thought of content, Jake's thought of content is dominated by feelings of guilt, hopelessness, and self-blame. He's preoccupied with the death of his colleague, believing it was his own fault. He confirmed suicidal ideation and recent attempt, though he claimed the attempt was impulsive rather than planned. He but did not explicitly deny the possibility of the future suicidal ideation. The nurse correctly identifies this as a significant concern, which led to the decision to keep him in the hospital, despite his claim that he will not do this again in the future. He did not report any delusional or paranoid thoughts, and the nurse confirmed he's not experiencing hallucinations or command voices.
Thank you, Chelsea. Hi, everyone. I'm Sabina Dhakal Ghimire. Today, I'm going to elaborate on mental health assessment part B, which are as belows. Perception will include how individual is perceiving things that can be either visual, auditory, or somatic hallucination. New South Wales Health 2015. Nurses taking an interview with patients should be vigilant and be able to distinguish between illusion and hallucination. It is crucial as includes different modality like auditory, visual, and somatic. Rustika Mokor et al. 2025. As in video, Jack admits that because of his ignorance, he lost his friend. Due to this incident, he started getting nightmares and constantly going back to the same incident. While telling his story, his eyes was filled with tears. Accepting to receive the treatment in hospital is also a sign that he wants to recover from the trauma that he persists with. This shows that Jack perceiving guilt and absence of any kind of hallucination. Moving on to the cognition, intellectual functioning, and memory concentration. This section of the evaluation covers the person's capacity to think or remember, as well as their orientation to time, place, and people. Their purpose for being here and cognitive functioning level, or the capacity to pay attention to the present and follow conversation. New South Wales Health 2015. During the interview, Jack posture was good. His orientation appears intact. He is known as he came to hospital and who called ambulance. He was able to recall past events from army and the incident of his friend's death. Due to the incident that has occurred, Jack often seems distracted by his internal thoughts as he pauses and does not make eye contact. He also struggles to maintain focus and concentration. This is in line with the known cognitive profile of schizophrenia, Badwell et al. 2021. Moving on to the insight and judgment, a person's insight, which can be classified as good, partial, or poor, is their capacity to understand their illness, its effects, and its implication. Whether the person can make the proper or rational choices is the main aspect of judgment. Their response might be rated as intact or impaired. New South Wales Health 2015. Jack's stating the clinician that he is not feeling well and talking about what step he needs to take further to solve the problem shows his insight is intact. Jack, willing to receive the treatment and aware of his illness and its impact on his mom and him, demonstrate his ability to take a right decision. Although the trauma that has occurred has given him slightly impacted on mental ability or treatment plan, and also proper supervision needs to be done. Moving on to the risk assessment is crucial part of MSc to keep individuals safe. Common risks associated are self-harm, harming to other, and suicidal risks. Jack has a history of suicidal risks which pose the harms on him. The interviewer asks regarding staying in hospital. He agrees, but he is constantly having nightmare of the incident day and he's doing nothing to make him busy. So it might involve that he can flee the facility and harm himself. So we got to focus on this one. So thank you for my time and thank you for listening.
Thank you, Sabina, for giving a detailed answer. So my name is Rudin Shrestha, student number 204044909, a third year nursing student. This is my student ID. And I'll be covering the last part of the question. So the last part of the question is closing of the interview, how it occurred and what was included. So in the final minutes, the nurse clearly demonstrated an overall summary of Jake's disclosure, which is also related to the recent overdose with alcohol following persistent low mood and trauma-linked distress, functional withdrawal, and prioritize immediate safety by proposing inpatient admission with information shared to the multidisciplinary teams. The nurse also validated Jake's emotional state, which is very important, assured that all the evidences and answers provided by him from the interview would be highly confidential and would be only between the multidisciplinary teams taking over his care. These factors presented by the nurse demonstrated proper risk management skill approach and clearly gives an understanding of the patient of what will happen next. So the next part of the question is critique of the interviewer's ability to close the interview. The nurse demonstrated therapeutic actions while closing the interview by demonstrating empathic tone, using respectful language, and validating Jake's feelings, which support alliance and engagement at a vulnerable moment. The decision to recommend admission after recent suicide attempts areas demonstrated an equal acceptance of the decisions of both the interviewers and the patients. So at last, the summary of the overall assessment is that Jake has a high risk profile, which is also known as suicide attempt by overdose, ongoing depressive symptomatology with protective factors including a supportive mother, willingness to help Jake, and Jake is also in conjunction around the attempt of compounding a risk. So at last, what needs to happen next is that first we should be proceeding with inpatient admission in the hospital with high observation of the vital signs and legal parameters. Secondly, co-producing and handwritten a written safety plan intervention, also known as SPI, and agree how it will be reviewed, and also involving by his mother as a support care planning. Lastly, providing a written information and use teach-back method to verify understanding of the immediate plan, the early schedule, and whom to approach if distress escalates. Thank you.